single point for questions.
Please.
Thank you. This is regarding the agreement about conditions. The council, of course, is able to add conditions if you.
They can't hear you.
You, the council, can add conditions if you think that it's appropriate. I want to remind you, though, with the DON process, there's a robust process that we go through with a lot of details to make sure that all of the parties of record have their opportunity to comment at appropriate times in order to give everyone an opportunity to respond to those comments, to have it be a public process. It's, according to the regulations, it is late at this point for there to be conditions requested, since there hasn't been an opportunity for public discussion of those conditions. Given that North Shore Medical Center has said that they are in complete agreement with these conditions, given that they've agreed in principle to commit to these, I would like to suggest that if both parties are willing, they could formally document that commitment, provide a copy to the council so that this is in the record, that this is part of the commitment. This would also keep a little more clearly the separation between essential services and closing, which is an ongoing process, and the DON process, which is a one-time decision.
Thank you. We'll open up to questions now for North Shore Medical or our DON staff. Council members? Dr. Woodward?
Thank you. Thank you for the complete presentations from all sides. As an emergency physician, my primary concern, number one, I applaud the behavioral health expansion because, as you know, behavioral health boarding is one of the true nightmares that are faced in many emergency departments on a daily basis. I think the greatest concern we heard is potential transport times from one facility to, or from Lynn to Salem in an emergent condition, as well as taking first responders out of service for extended periods of time. Obviously, if it's 6 miles, but it's 15 or 20 minutes at rush hour, that can make the difference between life and death. And I do think what's critical is that in this process, and it sounds as though you have an appropriate process, that you look at the possibility of maintaining a freestanding emergency department in Lynn. You mentioned urgent care, and certainly there would, 24-hour urgent care may be appropriate in some of your communities, but I do believe for a community of the size of the city of Lynn, not to have emergent services is going to be available 24 hours is going to be a real risk to the population. So I do hope in this letter of commitment, if you're willing to do that, that this is one of the major, and it sounded like one of the highest priorities for the legislators also. But I do think that if it isn't to be a condition, that it certainly should be articulated in the letter of agreement that is an essential service that's going to be evaluated very thoroughly in your move over the next 3 years.
I'd like to respond, Mr.
Sure, I would. As I mentioned in my comments, we've had 2 meetings in this group so far. They've been very productive meetings. We've shared completely and openly the data on various categories of patients that we serve. You're well aware, of course, and also various times of arrival of those patients and from what communities they come. So the entire group has a complete spectrum now of the current situation. We do recognize that we have an obligation to consider and explore all options that are open to us. We haven't taken any options off the table at this one time. We just think that since this is such an important issue, as you mentioned, that it requires a complete understanding and a complete discussion. We don't intend to take the full time of the 3 years to do this, but we have committed in all of our application to maintain the full service emergency department for that 3-year period while we're doing this construction. So we have a lot of time to work on this, and our hope is that we will be able to come up with a better way of providing emergency services to those patients and recognize all the variables you mentioned.
I would just add that I hope in this process it sounds as though you have a mechanism for reducing the boarding burden of behavioral health patients, but as you consolidate emergency departments, 2 large volume emergency departments, just having a larger physician plan, if you don't maintain outflow, you'll be boarding med surg patients, particularly where you're losing beds. And I think it's critical that you think about the outflow side of this equation so that you can maintain access to emergency services in one facility rather than two, if that's where you end up. Or even if it's freestanding, many of those patients are going to be transferred. So the outflow is a critical component of the planning process, I hope.
No, absolutely right, and both in acute care and in behavioral health patients as well.
Thank you. Other questions or comments? Dean Cox?
Thank you very much for all the presentations from everyone, and I appreciate how complex and difficult this conversation is. I was listening very closely to the recommendations that were being made, and clearly I think our council understands the need to be able to talk about, or the difference between talking about the issue of service delivery versus this particular DON request. And so I'm thinking specifically about the two recommendations that our council has made in relation to the things that I heard from presenters. And the first is to item number 6, where we've identified the need for additional representation, which was one of the things that was identified. I'm wondering about including in that letter of commitment the number of individuals, because while it sounds good to say let's have representation, representation can sometimes mean one person or two people. But being very clear about what representation actually means may address some of the concerns that I heard at the table. So clarification about that should be included in the letter of commitment. And the second is number 7. While I appreciate that the department will provide some oversight, there's a question that I have of so what that actually means. And what does it mean to bring the information back to us for us to review, and what the teeth are that we have to take any action other than to hear that something went well or something did not go so well. So I'm looking for something that's a little clearer about what number 7 actually means as well, so that indeed when information comes back to the council, and I'm glad that it will, that we are clear about what our next steps are. And we're clear about how to both protect the interests of the community, the interests of the hospital system, the interests of the council, etc. And we're not exactly certain what should be added to that, but it does concern me that it just feels weak.
Yes, thank you for those comments. The intent of that condition is for the department staff to review, of course, to present back to the Public Health Council to review, to ensure that our mission is being met, in that the services that are being rendered are adequate for the public health and safety. It's quite as simple as that. And if they are not, then we will revisit that as a council, as a department, and the intent then is to indicate or propose some additional action potentially that would address our mission. If in fact the providers are not adequately representing or adequately rendering services to ensure the public health and safety.
I guess I'm sorry.
Rebecca, why don't you go first, and then Dean Cox, you can follow
I
up.
just wanted to add, there are 2 pieces to this project. There will be quarterly reports to the department regarding the essential services closure process, ongoing basis, like opportunity for the department as a whole to respond and to make suggestions and negotiate with the applicant on how access is occurring as the closure proceeds. When they come back, when the DON staff brings this back to you in a year, it will be an opportunity for you to review what has happened during that year, to ask for more information, to ask for further actions. Because this isn't going to be complete within a year, there is room for you to have continued input.
Okay, I mean, I'm just again listening to where's the strength of the statement, and I see the words final arbiter, and I assume that that's what's implied by what you just said. That's not exactly what that says to me, but I'm hearing the intent of what you mean. Because the concern is in both hearing the needs of our community that is concerned about what's happening in that community, as well as what's our ability as a department to, and as a board, to be able to take action for things that may not have actually occurred. So on behalf, and so this is thinking about how do we actually protect ourselves and how do we protect the best interests of the individuals who are in the community.
One more thing I'd like to add is that, as you heard from Ms. Greenberg, this worked quite well for the council back in 1997. The Public Health Council found that having reports come back was a very effective process.
I appreciate it. I'm just looking for the strength of what the document, looking at what the document actually says. Thank you.
Tom, to you.
Thank you for being here, sir, and the other presenters. What's the process by which board members are appointed? I mean, how is that decision made?
Yeah, we have a nominating committee of our board that considers candidates on a yearly basis and makes recommendations to the full board. Those recommendations are then actually ratified by the partners board as well. So that's the corporate process inside North Shore.
Did you have a follow-up? Did you have a follow-up, Dr. Burns?
Yes, I think a lot of Dr. Woodward's comments, I applaud it, I support it. I think that one thing I would like to see is in a year that we revisit the issue of closing of the emergency department and not just put it off for, and as an open issue that they're committed for keeping it open for 3 years. The reason why I'm bringing this up is that I've had 28 years at Boston Medical Center where we merged a safety net hospital, Boston City, with a nonprofit hospital, university hospital. There was two cultures coming together. And I think what I'm hearing here is that the Lynn and Lynn surrounding communities think of themselves as a different community and have a different culture, class, race, ethnic differences. So when you bring these two entities together and the ways in which things are practiced, there has to be a strategy for how this is going to take place. So I was really putting this to you as what is your strategy to unite these two groups, open up the dialogue that's necessary so that there's exceptional care without exception. You know, that's hard to deliver, especially in a healthcare system that's based on money.
It is hard to deliver. We've worked very hard over the last 10, 15 years to bring various parts of the culture of the two organizations together. When I started at North Shore, they were two very separate institutions, and we merged various parts over that period of time, including bringing the entire medical staff together and the entire board staff together. And it is hard work, but it's doable, as you well know. I could be corrected by Ms. Rodman, but I do believe that we already have an obligation in the essential services agreement to come back within a year on the emergency department.
So I see that. And so do you have an actual plan for health equity? Because I think that's what they're talking about.
Yeah, so I think
And
that,
I think I think it's part of the idea that I'm here about the board, just beyond the board. It's part of the idea I care about maintaining essential services and access, and it's part of the bigger picture that I think people are feeling that there might be something essential.
yeah, I think we have two parts of that work. One is this work on making sure that our board becomes more diverse to reflect the communities we serve. We completely agree that we need to do that work. We've actually already started interviewing candidates to make that work, so we're on track to do some of that work. The second part of it around, the disparities in healthcare that exist in our Commonwealth and beyond, I think needs to be a continued part of the health needs assessment that we're committed to in this process as well.
Questions?
Well, we received a copy of the letter of commitment to the Connecticut. When is the letter of commitment, where does it stand in process of?
Rebecca, do you want to address
This
it?
is something that you can, as the council, can ask.
You can ask for it, Dr. Woodward.
I would suggest that we, as you articulated, that we have this letter where we've heard from several sides their concerns and interests, and it sounds as though there's a commitment to address these. And I think it would be important to have a letter of commitment from the various parties reflecting the issues that have been discussed today, and that the Public Health Council see a copy of that letter. And that might guide our further discussions in a year or as we go forward.
Dr. Bernstein?
No, this is a follow-up to Dr. Woodward's point that I consider the boarding into the emergency department as one of the major health and safety issues, quality issues of the day for emergency medicine to the public. So what, if you're opening up all these psychiatric beds, this is definitely a solution. I think that's what we're both looking for. What would you tolerate as an acceptable level of boarding in your new emergency facility? That's one question. And associated with it is the issue of addiction services. Because I think the dual diagnosis population will use your psychiatric facilities, but we have a lot of folks that are sitting around in our emergency department that have no place to go for treatment for addiction. We just saw that very moving public service announcement.
Yeah, so we've had, as you might imagine, hours and hours of discussion about this, and I think our commitment to expand and actually double the number of mental health beds that we have on the campus will help that. But as you well know, there's such a need for this statewide that I suspect those beds will be absorbed pretty quickly, right? To your question about what's an acceptable level, what I've said to our team is there is no acceptable level. We should be able to move patients to appropriate inpatient settings as fast as they come in the front door. That's the only way to have an emergency department that will function correctly. So we've planned the new emergency department with that capacity. There'll be considerably more physical capacity in the new emergency department we have today. Secondly, we will build into the new emergency department something that I know you and your colleagues are familiar with, and that is a dedicated observation unit, so that we don't have those patients backing up treatment facilities. We don't have such a facility today, so that will help. I think the most important thing that we have to continue to work on, and not only at the North Shore Medical Center, but really statewide, and again, you and your colleagues know a lot about this, is really making sure that we are continuing to focus on the appropriate use of the emergency department. There are still, in our emergency department, somewhere near a third of the patients that come to the emergency department, they really don't need to use the emergency department. And that needs to be a part of our ongoing planning work around population health management, that from both a financial point of view and an access point of view, opens points for those patients to get care where they're not forced to go to the emergency department. That's something we're working very actively on in the entire part of the system.
Commissioner.
Yes, Dean Cox.
So I'm still going back to the letter of commitment, because we've kind of talked about it, but it's not exactly saying what that means. And it seems that there are some things that we've heard today that may be important to add in a letter like that. And I think that there are three that I've heard. One is about the membership on the committee, so that while there is interest in, and I'm glad that you were beginning to address that, it does seem that being more specific about that in a letter commitment would be very important. The second is about stakeholder engagement, which I think means, but maybe others can help to clarify that, means involvement of others in the community to talk about what's actually happening. And the third is about quarterly updates. Those seem to be the things that I think that I've heard that are not specifically identified in the staff recommendations. Is that right, Rebecca?
Yes, Dean Cox, those are essentially, those are part of the essential services closing process. Right now, North Shore Medical Center has begun quarterly reports to the department as part of that process. It's not part of the DON. As you know, this is complicated because of the intertwining of the DON process and essential services closing process. So that quarterly reporting has begun. We've already received one. And that will continue until after the closure, and then there's a report a year after the final closure.
So then it's appropriate then to think that the other two items, since that one is already in play, that the other two items that would be included in such a letter would be about membership on being very clear and specific about membership on the board, as well as a matter of stakeholder engagement.
It would be my advice that you treat this letter a little bit separately from the process in front of you today. That you ask for it, but that you give them the opportunity to work that out and make sure that it is an agreement of those parties that you then review, but as a separate matter, since the issues in it are more entwined to these.
That's very fair. I'm open to that. And certainly want to allow for the process to move forward, but also want to make certain that we're being clear about some specific actions that should be taken. So I'm willing to listen to your recommendation of treating these two things as being separate, but there are those issues then that seem to be identified as being the issue around membership of the board, stakeholder engagement, quarterly reports. Those, as I look down the list of the things that were recommended, those seem to be the ones that seem to stand out, and I just want to make certain that I'm correct.
I would agree with that.
So then as a separate process, then this letter then, with the parties having conversations with each other, would consider those, and there may be additional things that they want to consider as well. Would that letter come back to us?
If you would like it to, yes, you can ask for that.
It would be good, I think. Commissioner, is that okay?
Yes. So to separate those out, because even though they feel intertwined, the essential service component, which does have several of the pieces you mentioned, but maybe not to the level of clarity that you're asking for, is a separate process from the DON, which is about, as you know, the expansion of the Salem campus based on the criteria and the independent cost analysis that Mike went through.
Certainly.
Any other questions on that before? Rebecca, I believe Angela Levine wants to come forward. Could you make some space?
I just want to clarify one point.
Could you introduce yourself as well?
Thank you, Commissioner, Council members, Andrew Levine, Council to North Shore Medical Center. On the issue of the stakeholder involvement and engagement, the current DON condition does have an overlap with the reporting of the urgent care work groups that are currently meeting on a regular basis, as Mr. Norton and Ms. Lawrence has explained. So that mechanism for bringing that to you, the council is already in this part of the DON condition. It is set forth in that as one that we've phrased. So in terms of the reporting back on that discussion involving emergency and urgent care services, the study of what's appropriate for the area is already embodied in this DON staff recommendation of approvals and conditions that Mr. St. set forth for you.
Do you have a clarifying question to that?
No, I think my concern is I'm just listening to the various voices that have been expressed today, and how to be respectful to those voices, and also how to be respectful to the work that the hospital system is doing as well.
Thank you.
So I think what I'm hearing is, Mr. Norton, you're hearing this as well, is the council is asking for you to make a commitment to provide this letter of commitment with the features that Dean Cox outlined. Are you in agreement with that?
We're very comfortable doing that. I think we already have the core of that agreement in the work that we've already done with the legislative delegation with our task force, so I think we can get it very easily.
Okay. Any other questions around the DON? So we have an understanding that this letter of commitment will be done, and Mr. Norton and his team have accepted that. That will come back to us at the August PHC, and now I will ask you to vote on the DON at hand related to the Salem campus expansion. Any questions before we do that? So I'd like to ask for a motion to accept the staff recommendation for approval of the North Shore Medical Center's substantial capital expenditure and substantial change in service regarding new construction. May I please have a motion?
With the conditions specified.
Right, so we're not adding a condition with the request for the letter.
I'm just saying with the condition, I think it's important to say with the conditions that are specified by the department.
Yes, with the letter of commitment request.
Well, pardon me, I think that Dr. Woodward is specifying that there are conditions included in this application.
Of course. Yeah, I take that as, yes, with the conditions as specified in the DON as reviewed today. I misunderstood what you're saying. May I please have a motion?
So moved.
Dr. Woodward, can I have a second? Second, Dr. Rosenthal, all approve?
Aye.
Any opposed? Any abstain? Okay, thank you. The termination of North Shore Medical Center is approved. Thank you.
Thank you.